guys, this is Caesar with Nursing School Made Easy, and this lecture is going to be focusing on two things. One, urinary incontinence and urinary retention. Again, these are all geared towards preparing you for that NCLEX exam. So we're going to try to make it as brief as possible and give you the most information. So let's get started. Urinary incontinence. This is pretty much just the uncontrolled leakage of urine. So there is constant dribbling, constant voiding, and let's focus on that first. So we're going to again talk about urinary incontinence. Now, one thing to remember is that urinary incontinence is more prevalent in women. See if we can get that to focus a little bit better. Okay, so this is more prevalent in women. Now, what are some causes? Confusion, depression, restricted mobility. Biggest ones that we want to focus on are fecal impaction or constipation. Also, some type of spinal cord injury. Fistulas and pregnancy. So, especially with women that have had multiple pregnancies, you're going to find that they have problems with urinary incontinence. Those pelvic muscles, they get weaker, they get overstretched, and again they get weaker and weaker. Okay, now that's urinary incontinence. Now let's focus on urinary retention. Let's use a different marker for that. Now, like the name implies, you're going to have difficulty voiding, difficulty getting rid of that urine. And causes for this are: 1, bladder outlet obstruction. Now, what that simply means is there's an obstruction of the urethra somehow. Now, remember that long ago, especially this will be more in men, we talked about the kidneys, right? And in men, the kidneys are going to come down, and you're going to have your bladder. So urine is going to come from your kidneys into your ureters, and it's going to deposit into your bladder. And in men, you have the urethra to take urine out, but right behind that, or right below that bladder, is something called the prostate gland. If this prostate becomes enlarged, it is going to cause an obstruction. So in men, the thing that causes this obstruction most of the time is some type of prostate enlargement. Now, there could be another reason also for this retention. This could be something like a deficient muscle contraction. So again, the muscles are not contracting when the person goes to void. They're not squeezing. If that squeezing action isn't occurring, then the bladder won't be able to empty like it should. Now, again, this will most likely be due to some type of neurological disorder. It may also be caused by long-standing diabetes mellitus, chronic alcoholism. Now, with the chronic alcoholism, or with some of these, the bladder gets distended, gets really big. Remember that with, for example, diabetes mellitus, you have frequent urination. You want to pee all the time because you're losing a lot of water. Well, your bladder becomes really distended, and at some point, maybe those muscles are overstretched and therefore cannot contract. Now, some other reasons are the anticholinergic drugs, the opioids, and calcium channel blockers. Now, these are just a few. Now, again, what these do, they're going to cause bladder distension. So again, your bladder is going to get bigger, it's going to become over distended, and again, that's going to affect those muscles. It's going to affect the ability of those muscles to contract. Now, what are we going to do for these patients? Let's focus on urinary incontinence first. Number one thing you can tell these women is to perform their Kegel exercises, to try and exercise those pelvic floor muscles to get them stronger again, especially after they've had a baby. You want to tell them to perform these again to prevent that urine dribbling, that incontinence. Two, you may give them something like a alpha adrenergic agonist. Now what these do, these are going to increase bladder sphincter tone. Now you have to be careful with these drugs because these are also going to increase hypertension and increase or cause tachycardia. Okay, these are the alpha adrenergic agonists. So again, be careful with these because these cause hypertension and tachycardia. You could also give medications such as Detrol, transdermal oxybutynin, Sanctura, Vesicare, and nclex. Now, these all have side effects, and these side effects include dry mouth, dry eyes, constipation, blurred vision, and somnolence. Now again, I'm going to repeat those again: dry mouth, dry eyes, constipation, blurred vision, and somnolence are some of the side effects of these drugs here. Also, what you're going to tell your patient to do is to avoid caffeine and alcohol. These are bladder irritants. Okay, it's going to irritate the bladder and make it more likely for them to want to void. You're going to tell them to begin a scheduled time to void, typically about every 2 to 3 hours. Again, you're going to try to do this so that the bladder doesn't become too distended to prevent incontinence. Okay, so tell them about getting a scheduled voiding time. You can tell them to stop smoking. The other thing that we're going to do is we're going to tell that patient to prevent constipation. Now, we already talked about some of these drugs that do cause constipation, so you're going to warn them about that. You're going to do or you're going to tell them to prevent constipation as much as possible. So you're going to tell them to keep hydrated. So make sure that they drink plenty of fluids, to increase their fiber in their diet. And also, if at all possible, to use a stool softener. Again, the key here is to prevent constipation. So that is for urinary incontinence. Now let's talk about urinary retention. Again, urinary retention will be not always, but more likely in males due to that overgrown prostate gland. So for urinary retention, you're going to tell these patients to keep a bladder log. You want to know how often they're voiding and how much. Are they voiding a lot? Are they voiding a little bit? If they're voiding many, many times and just voiding a couple of cc's, well, then that means that, yes, they're having problems with retention. You can also do, or this would be more like to find out if they are having problems, and then we'll move on to the interventions here slowly, but you want to do a urinalysis. Is there an infection going on? Is this retention caused by DM? And check to see if there's sugar in the blood. You're also going to check the residual volume. And you can do this by one of two ways. You can do a straight cath after they void and find out how much urine is left, or you can do a bladder scan and find out how much is left again after they void, because you want to see how much they're able to empty out. It's not going to do any good to scan them before the void. Now let's go ahead and get into the interventions. Same thing as with the urinary incontinence. You're going to want to tell them to get a toileting schedule. Again, every 2 to 3 hours, or even every 2 to 4 hours. You don't want that bladder to get too full. It'll start to cause other problems. You want to tell them to begin double voiding. So have them sit on the toilet, try to empty out as much as possible, wait a few minutes, and then try to void again. So that would be double voiding. If they're having difficulty, they just cannot empty their bladder, then you may have to straight cath. Now in this case, you can use alpha adrenergic blockers. Examples of these are Flomax, Cardura, and Uroxetrol. You're also going to tell your patient to maintain fluids. You don't want them to dehydrate, but instead of consuming large amounts of fluid in a small period of time, you're going to tell them to drink small amounts throughout the day. You're going to again tell them to avoid alcohol. Remember, alcohol is going to make you want to pee multiple times. Okay? But we have a problem with retention, so you will be unable to. So you want to avoid alcohol. You will, however, tell them to drink coffee or teas which have caffeine, because this will give them the urge to pee, to void. Okay, so to remind them to go to the bathroom and maintain that schedule.